right. So I'm just come here to the Methodist Church in Seaton Road. Done. And you've just had a no label session, which apparently you've been running, 3 or 4 years?
I think it's probably 4 years now.
Excellent. And this is John?
Yeah, I'm John, yeah.
And what are you doing for Walton Parish Nursing?
Well, I'm a mental health nurse, so I help people, support people managing their mental health, and obviously no labels is part of that, so it's a social support group for people with mental health and emotional issues, which I always say is all of us really. So
we're all in need of a prop occasion, aren't we?
And because people are coming to the group, it doesn't matter whether they live in Walton or not for this particular group.
Right, so your outreach for this is virtually anywhere on the peninsula?
Anybody can come.
Right.
We have a sort of core group of people. Today I think we had 16 or 17 altogether.
Yeah.
People coming and then volunteers. So that's a good number. Usually there's at least sort of 12, 13 people.
Good, excellent. Right, now Lorna, you've been doing this for how long now?
I just had my 10th anniversary on the 1st of November.
So you've actually been with Walton
Parish nursing, for 10 years.
Have you really? It doesn't seem a day too long.
It doesn't, no.
Does it?
We haven't changed too much.
So the original funding for Walton Parish Nursing, I understood there was a lady who made a significant grant to the trust originally, or am I misreading that?
There was one lady that left some money in a will.
Yes.
Yeah, just, part of the funding, yes.
Which actually, something like that gets you off to a good start, doesn't it?
I don't think that was original though.
No.
It was Maidstone Road to start with, Maidstone Road Baptist Church, then Seaton Road Methodist Church came in, and then St Mary's Church.
So really it's the three key churches within Walton that lead it. But that being the case, is it primarily you're looking to do, if we look at the whole range of stuff you're doing, physical, mental, social and spiritual well-being to people in the local community, you're doing health consultation, leg care, end-of-life care, which is something sadly that's been needed, particularly during the COVID period. Those things are specifically within the Walton sort of parish area, is it, in the main?
Yeah, well, we cover the whole of the Walton area, so that's geographical, but a bit like no labels, the groups.
Yes.
Chair-based exercise anybody can come to, because they're coming to us rather than us going to their homes.
Right.
And obviously anybody that goes to the 3 Walton churches, we will visit, or they can come to the groups, but saying that, you don't have to have any church connection at all to be part of...
Providing you live here. Residency is, or even a visitor, or a worker coming into Walton.
But regarding the funding as well, obviously we've got grant applications going in and things like that as well. So we've got a very good management team and trustees that look after the funding side of things. So John and I can just get on with work.
And do the job you need to be doing.
So the churches don't have to produce the money to fund it, because we do lots of applications for grants. So
on that basis, what is your availability with, you obviously can't do 24/7 stuff, can you? That's that. So you're sort of part-time?
Importantly to notice really is we're not an emergency service.
No.
And we're not a statutory service, so we're not trying to...
You're an additional supporting,
So we both work part-time, don't we? So Warner does 3 days a week, and you and I do 2 days a week. Right. So that's,
but that days a week could fit into a particular patient's type of need if it was, say, end-of-life care or some such.
They are set days.
Yes.
Obviously, if they need help outside that, then we do a lot of signposting. So if it's end-of-life care, we work with the district nurses, GP surgeries, and then John's obviously got connections within the mental health service, so it's like a team effort. They don't solely rely on us, because obviously we are part-time. And hopefully, we can cover that where they need.
And equally, you do a fair bit of signposting to other medical care within the whole system, because I think most people, it's sad to relate, find the whole health delivery system a little confusing as to whether it might be the GP or the hospital or whoever it might be.
Yeah, we've got a really good connection with the 3 GP surgeries.
Good.
So, constantly, I mean today, we've done several emails or phone calls to the GP surgeries because it's just joined up thinking and it provides that whole person healthcare. Yeah.
Now we've just been through COVID, the whole sort of 12, 20 month lockdown-ish. We're now coming into the winter. I pray desperately we're going to have a light winter so we don't have lots of falls and breaks and putting the system under even more strain. So is there anything that you tend to do in the winter that you wouldn't normally be doing? Is there any thoughts that you've been having on any further support that's going to be available?
I think it's just really to carry on as we are, because we're giving a lot of support to quite a lot of people, and I think in the winter, obviously the dark days and people get quite low. I honestly think if we carry on what we're doing and then try and pick up any additional needs, hopefully, between us all, we'll get through winter, and if people are poorly and they can't get a GP appointment or can't.
Yes, I saw that you do a sort of a transport system if need be or can. Or arrange and help.
But also connection, sort of phoning the GPs for those patients as well, because that's quite hard sometimes for them to get.
Yes, it is.
But if a healthcare professional speaks to the GP on their behalf, then that does help.
Then you can get to the detail quickly. Yes. Yeah. I mean, I'm a member of the Grove PPG group. And they were saying that they've now got out to all the housebound and did the booster jab, and I assume they do the flu jab as well. And I think we're all saying people that haven't been fully vaccinated, it's in everybody's interest, perhaps you do. So on that basis, I take it both of you are fully vaccinated plus, ready to go everywhere.
Yeah, I mean, we would advise people to be vaccinated, but we can't force people.
That's one of the,
We wouldn't not see people
if they weren't vaccinated.
I mean, I know I recently had my booster, so I'm as up to date as I can be. But we do take precautions, so if we're in very close contact, we would wear masks and hand washing, all those sensible things really. And we do lateral flow tests before we come to work. So.
Okay, so contact details for you. I see you've both got a mobile number registered on your information sheet. So we'll put that up following the video clip. And what we'll do, hopefully in the future, is come and actually look at some of the group things that you're doing, such as today's. Your event here was well attended. People seem to be happy and getting on with things. And lovely to have seen you. And hopefully have a lovely Christmas. Because it isn't that far away. Done all your shopping?
No.
What?
Not even started. But
that's what I like to hear.
Christmas to all the viewers.
Well, thank you very much. And we'll see you again soon. Thank you.
Walton Parish Nursing is a registered charity provided by the 3 churches in Walton. That's the Baptist Church, the Methodist Church and St Mary's in Walton. Walton Parish Nursing is able to offer physical, mental and social and spiritual well-being to people in the local community. Health promotion, such as health fairs. It offers chair-based exercise classes, health consultations, leg care, end-of-life care, support with mental health issues, signposting to other agencies, in other words, health advice, transport to medical appointments. Now, everyone is welcome to the following groups wherever you live. And that is the health drop-ins, which are held at the Leydens in Langley Avenue on the first Tuesday of the month between 10 and 11:30 in the morning. And then there's the drop-in at Collimer's Court, which is held Thursday monthly 10 to 12 noon. Don't forget there's also craft activities. Collymore Court Craft, which is held on Wednesdays between 2 and 3. Crafty mornings at the Leydens on the 1st and 3rd Tuesdays of the month. And Craft from the Heart at Maidstone Road Baptist Church monthly on Wednesdays 2 to 4. There is also No Labels, which is for adults who experience issues with mental health, which is held 1:30 to 3:30 on the 2nd and 4th Tuesday each month at Seaton Road Methodist Hall. And Visibility, a group for working age people with challenging physical abilities. And this is on the 2nd Thursday afternoon at the Seaton Road Methodist Church. We work with a team of trained and supervised volunteers. We are a registered charity and our charity number is 1151953. Our official address is Walton Parish Nursing, which is WPN office, Maidstone Road Baptist Church, Maidstone Road, Felixstowe, IP 11 9E for Echo, D for Delta. The contacts are, if you wish to contact Walton Parish Nursing, it's all one word, lowercase, contact us, and then at waltonpn.org.uk, or our webpage is www.waltonpn.org.uk.